Good afternoon, everyone, and welcome to the Framework for Mental Health in Multicultural Australia webinar. My name is Ruth Das. I'm the Partnership and Engagement Lead for the Embrace Project. And on behalf of the Embrace Project team and Mental Health Australia, I'd like to welcome you to this afternoon's webinar. This afternoon, we're having three speakers, myself, my colleague Ash Batten, who's the Senior Project Officer at the Embrace Project, and also Alex Bickford is joining us as a guest presenter from the West Australian Primary Health Alliance. I'd like to acknowledge the First Nations people as the traditional owners of this country throughout Australia on all the lands that we're meeting on this afternoon, and their continuing connection to land, sea, and community. I'd also like to pay our respects to First Nations people and their cultures, to all elders, both past and present, and especially in this season of the referendum, express our support to voice, treaty, and truth-telling. And I'd also like to particularly welcome anyone from a First Nations background to this webinar. I'd also like to acknowledge the unique contribution of people with lived experience of mental ill health and those who love and care for them in championing mental health reform. We celebrate people of all backgrounds, genders, sexualities, cultures, bodies, and abilities. This afternoon's session will follow this format. We'll spend the first 5 minutes setting the scene around what Multicultural Australia looks like and why multicultural mental health is particularly important for all of us. We'll spend some time drilling down into the framework for multicultural mental health in Australia and provide an overview of the modules and all the particularities of the framework and how it can be applied to your workplace. We'll hear from Alex on a particular case study on how the framework has been applied in a primary health network setting in regional and Western Australia. Then there's the opportunity for you to ask questions and for us to provide some answers. If you've just joined us, please note that you can post your questions in the Q&A function at the bottom of your screen. I see we've already got 2 questions there, which is great. If you'd like to vote for a particular question that you see there that you're particularly interested in hearing the answer to, please use the like function and like that question, and that will prioritise that particular question up the list for you. And then we're going to finish this afternoon's webinar with looking at some next steps and how you can take what you've heard this afternoon back into your work setting and apply some of the learnings. So the purpose of today's webinar is really to provide you an overview of the framework for mental health in multicultural Australia, which we call the framework that the Embrace Project promotes for all mental health services. We want to really give you some guidance and some nuts and bolts insights into how you can apply and implement the framework into your work setting. And as part of that, as I've mentioned, we're going to showcase a study that really fleshes out and demonstrates how the framework has been implemented. So this webinar is really designed for Australian mental health services, community organisations that deliver mental health services, practitioners, primary health networks, or services that work effectively in a multicultural context. If you do come from a multicultural community, the information that you hear this afternoon might not meet your unique needs, but you are very welcome to listen and to learn about the framework. But feel free to reach out to us in the future for further information about resources that are available for your community, or to have a look at the Embrace website where there's a variety of resources that would be really relevant and useful for you. So why is cultural responsiveness important for mental health services? Australia, as we all know, is a very multicultural nation, and almost half of Australians were born overseas or have a parent who was born overseas. So we're a very diverse community. And over the past 70 years, more than 7.5 million people have made Australia their home. What we know about people who come from refugee migrant backgrounds is that they have reduced access to mental health services, but that does not reflect reduced needs. We know that there are many safety and quality issues that are particularly pertinent to people who've come from migrant and refugee backgrounds. Particularly, people have needs for communication in the language that they prefer and they know. There's issues around trust. There's issues about developing empathy. And of course, we need to provide trauma-informed care, particularly for people from refugee backgrounds. So we know that refugees and asylum seekers are at greater risk of developing mental health problems and suicidal behaviours than the general population. So for all these reasons, particularly, we need to make sure that our services are relevant and suitable for people who are coming from refugee and migrant backgrounds. Why is this important? Because accessing support and information about mental health is for everyone in the community. We know that there are particular issues around stigma, cultural understandings and meanings around mental health, and particular barriers for people from refugee and migrant backgrounds that prevent them from discussing mental health issues or accessing services. Often our mental health services really take on a Western or biomedical model where the prescribed treatments are from a biomedical model, medications, counselling, and there are particular nuances that might not make that really readily acceptable to people from migrant and refugee backgrounds. So services need to be flexible and culturally responsive in order to meet the needs of everyone in our community. So what is the change that we want to see and what are we trying to do by using the framework? We want to see services and mental health services particularly that are responsive, adaptive and tailored to the needs of people from refugee and migrant communities. We want to see people from migrant and refugee communities have attitudes and beliefs that embrace positive mental health and help seeking. We want to see levels of stigma reduced amongst migrant and refugee communities so that people feel able to discuss mental health and seek support when they need it. We really want to see positive mental health and well-being outcomes for people who access services so that when people do approach services, they get the support that they need and it's a useful experience. And in doing that, what are some of the principles that we want to incorporate and what are the things that underpin the way that we work? First of all, we want to work with refugee and migrant communities in a way that's collaborative and that shares power and authority. We want to co-design services in a way that's relevant and meets people's needs. We want services that are person-centred and not service-centred. We want services that come from a culturally informed basis and an evidence base. We want flexible engagement with refugee and migrant communities, individuals and families in a time, a place and a setting that's suitable to them. We want proactive outreach, which is really important. We don't want to wait until people come to our services, maybe in a crisis or maybe at a late stage. We want to go out to people and meet them where their needs are. And most importantly, we want a whole of organisation approach to working with refugee communities, refugee and migrant communities, and that approach to change. So this is really about how organisations approach refugee and migrant community mental health needs. So how will the framework allow me to achieve this change? And that's the key question that we're hoping that you'll consider throughout today's webinar. What is this tool called the framework that's going to give me scaffolding, structure, comprehensive stepped out methods to make sure my services are culturally responsive? So keeping that question in the back of your mind for when we go on to talk about the framework, I'm just going to now move across to what the Embrace project is and what we try to achieve. So the Embrace project is funded by the Australian Government Department of Health and Aged Care as a response to recognising that people from migrant and refugees have unique needs and that specific targeted and nuanced measures need to be developed. The Embrace project provides a national focus on mental health and suicide prevention for culturally and linguistically diverse communities. The Embrace project aims to improve the cultural responsiveness of mental health services and the workforce, and we do that particularly through the framework, and the framework is one of the key tools that we use to assist you in your service. And also we aim to increase mental health awareness, literacy and capacity in CALD communities through a number of different initiatives, some of which I'll talk about today, but there are a lot of different initiatives that fall under that umbrella as well. So really the Embrace project has two main aims. One is to strengthen the cultural responsiveness of mental health services so that when people go to a mental health service, they receive a treatment and support that is relevant, incorporates their cultural, religious, diverse needs, and can provide support in a way that's accessible and meaningful to them. Secondly, we want to make sure that mental health communities are strong and well-informed and stigma is reduced. So we want to strengthen the mental health of migrant and refugee communities. So that's our two main focuses of the project, and all of our activities fall under those two main aims. One of the things that the project really uses as a mechanism to distribute information and to provide resources is the Embrace project website. And this is a photo of the front screen that you'll see when you go into the website. And those that you have been on the website will be familiar with this screenshot. On the website, there's a hub of information, resources, translated materials, best practice examples, policies, case studies, and support services for CALD communities. So this is where the framework is housed, and this is where you go into the website to find the framework and all the details that Ash will take you through a little bit later. So the website has two main arms or two prongs to the website, and you'll see that the purple one banner is for community information, and that's for multicultural and migrant refugee communities. And then the second one, which is the aqua blue or teal blue, is for mental health service providers and health professionals. And so going into those two sides of the website will direct you into all of the different resources that we have within the Embrace website. So this is what that looks like when you drill down further into the website. The community side of the website has a selection of personal stories that we've collated over a number of years, videos, both in English and other languages, multilingual information, lots of fact sheets around mental health conditions, how to access support, what to do when you go and see a GP, what sort of questions to ask, a whole lot of information in 17 and 19 languages, up to 19 languages. Then we have a section on mental health services around Australia by state and territory, where people who are looking for support can go into that section and find a service and numbers and website information about services. And then we also have a section on community organisations like migrant resource centres and settlement support services that people can have a look at through that part as well. So the second prong or the second arm of the website is for service providers. And as I said, that's where you'll find the framework, but that's also where you'll find the Knowledge Hub, which you can search for research articles, journal articles, case studies, project reports of all the different initiatives and research and best practice around Australia in multicultural mental health. So I'd really encourage you to go in there and explore and see all the wonderful resources that are in there. So this is what the community side, some of the resources look like, the personal stories, the videos, and the translated fact sheets. So now we're going to move on to the section of the webinar where we talk about the framework as a tool and to provide structure for your service. So as we go through this section on the framework, think about how you might be able to apply the framework to your work setting and your service. And I'd like to now hand over to Ash to walk through the framework with us all. Thanks, Ash.
Thank you, Ruth. Yeah, I'll now take you through the framework for mental health in multicultural Australia and its structure. So the framework is designed to engage with mental health services and health professionals in two distinct ways. One is on an organizational wide level, and then one is with the workforce at an individual and health professional level. This is to enable reflection and delivery of culturally responsive care and practice. Next slide, thanks. So the framework is a free, nationally available online resource which supports organisations and individual practitioners to evaluate and enhance their cultural responsiveness. The framework is unique in that it is a quality improvement tool, and it has been mapped against national standards to help support you with existing accreditation requirements. It supports mental health services, individual practitioners, PHNs, and others to work more effectively in a multicultural context and with multicultural communities. It consists of a tailored set of modules and self-reflection tools, which will later guide you through. Its cultural competency standards and principles are transferable within different health settings, and it is self-paced with free access to resources and links along the way. So when you register and log onto the framework, you will see the screen. It will look like that. So you can also, while you're in the webinar, scan the QR code on the screen directly, and you'll be taken to the framework login page. So if you already have an account, you just log in via username and password. Otherwise, you can register for the framework right now, and it only takes less than 30 seconds. So the framework structure. The framework structure consists of an introductory module. So that module has been developed by the Centre for Culture, Ethnicity and Health, and it provides an introduction to cultural competence and is a great starting point for those of you that have limited experience in culturally responsive care or would just like a refresher in this area. So that's about a 60 to 90 minute online module when you register. And the next component of the framework are the two self-reflection tools. So there is one for mental health services and primary health networks, and one for individual practitioners. The framework also consists of 4 core service modules, which all cover off different topics and areas on cultural responsiveness. And when done together, they provide a very comprehensive review of cultural responsiveness, which I'll now take you through in the next few slides. So the self-reflection tools, they provide you with an opportunity to take a brief overview assessment of cultural responsiveness. So they're a great starting point if you want to identify your organization's key priorities and decide on which module you would like to start with. So each of the self-reflection tools only take around 30 to 60 minutes, and you'll be guided through different principles and indicators of cultural responsiveness to help identify your priorities. So after you have selected and completed a self-reflection tool, the next step is to pick a module, and then you will go through this process. So this slide demonstrates the different stages of the process and the indicative timeframes. So each of the modules will take you through an introduction. So that consists of some information around each of the module topics. Some of them include some videos to guide you and provide some context. That will take around 15 minutes. Then you'll move on to the self-assessment phase. So this will be your self-assessment against each of the different principles and indicators in each module, and that will take around 30 to 60 minutes. The action planning phase, which is next, that will involve you developing actions based on how you've assessed yourself against the different indicators and principles and how you would like to improve that. The next phase is implementation. So that will be the phase of where you will implement the actions that you have developed based on your assessment. This will vary based on an individual and an organization, and also on the resources and capacity available. And that can take around 3 to 12 months, depending on that. And lastly, you have the review phase. So you can come back anytime into the framework and do a review, which also takes around 30 to 60 minutes. And that will involve assessing yourself against the principles and indicators in the module and comparing it to your original assessment. So some of the key service module elements that we wanted to highlight is that you can actually start with any module. You do not have to do the modules in order. So when you do your self-reflection tool, you can identify which module is more relevant to you or your organization, and you can start with that. So when you log onto a module, you'll see this image which displays a principle, and that is leadership and resourcing. And then you'll also see the indicators that have been highlighted below. So for example, indicator 1.1 is strategic plan, and you'll then assess yourself according to the different progress levels, which I'll cover off. So each of the modules are self-paced, and you'll see there's links to resources along the way that can help guide you through your assessment. And we also have framework user guides available on the website, which will also help you through the process. And lastly, once you've gone through the entire process of the module, you can also print out a certificate of completion. Thank you. All right, so in terms of the progress levels, when you assess yourself in the module, so when you complete the self-assessment of each of the different principles and indicators, you will then rate your performance against these 4 different progress levels, which are detailed on this slide. So the first one being pre-entry. So that will be when your organization or yourself has limited activity in the area to date. And then the next level is starting out, where your organization or yourself will have some level of awareness or understanding of culturally responsive mental health service delivery. The next step is developing, where your organization or yourself have a proactive approach to implementation. And lastly, the last progress level is advanced. So that is where your organization or yourself have are leaders in this field or have a more advanced understanding. Thank you. So in this next slide, I'll cover off each of the core service modules and each of the principles and indicators they cover. So this is to help you get a better understanding of the areas that you would be assessing yourself for cultural responsiveness in each of the different modules. So you'll see on the screen service module 1, which is called Planning Strategically to Meet Multicultural Community Needs. This focuses on strategic planning for mental health services and workers in a multicultural context, and covers off leadership and resourcing and data collection and research. So we're just on module 2 now, which is developing safe, quality and culturally responsive services. So this module takes a deeper look at how to ensure safe, quality and equitable service delivery in multicultural communities. It really examines what cultural responsive looks like when people access and use mental health services, and it covers off equitable access and service delivery as the key principles. Service module 3, which is working together to promote mental health in multicultural communities. This module really looks at effective engagement with multicultural communities and stakeholders, in addition to mental health promotion and also suicide prevention in a multicultural context. It covers off consumer and carer engagement and co-design, collaboration and stakeholder engagement, promotion, prevention, and early intervention. The next module, which is the last module for the framework, is service module 4, and it's called Building a Culturally Responsive Mental Health Workforce. This module really looks at the policies and practices that are needed to help build a strong and culturally responsive mental health workforce across Australia. And it covers off the following principles, which are professional development, diversity and inclusion, and resources and support. Thanks, Ruth. So this actually brings me to the end of the framework overview. So we just wanted to highlight that the framework currently has over 2,000 users, and it has been embedded by various mental health organizations, health professionals, and primary health networks. And I'd like to now hand it over to Alex Bickford from Western Australia Primary Health Alliance to take you through how they have implemented the Embrace framework within their organisation. Over to you, Alex.
Thank you, Ash. It's great to be here, and thank you for the opportunity to talk about how we've implemented the framework. So I'm going to talk about how we've utilised the Embrace framework to enhance cultural competency and capability across our primary health network. I'd like to just acknowledge I'm coming to you from Whadjuk lands of the Noongar Nations, and just like to pay my respects to elders past and present. Thanks, Ruth. So just a little bit about WA Primary Health Alliance and about primary health networks. So we oversee the 3 Western Australian primary health networks. There's 31 primary health networks, or PHNs, across Australia, and they're funded by the Australian government to commission health services to meet the needs of people in their regions and address gaps in primary health care. They also work closely with general practitioners and other health professionals to build the capacity of the health workforce. And primary health networks also have a role in integrating health services at the local level to create a better experience for people and to encourage better use of health resources and eliminate service duplication. Thanks, Ruth. So one of the things that our primary health network have been looking at is the development of a multicultural competency and capability framework. And the Embrace framework has been a crucial part of our work in developing this framework. Forgive me, I'm going to refer to a few frameworks on this particular slide. So the framework that we've been developing will provide a mechanism to build capability and measure the performance of internal and commissioned activities to ensure cultural competency and safety for staff and people accessing our commissioned services. So we've been working on this document, and it will include an implementation plan and commissioning guidelines, and it will complement some other recently developed frameworks. And we've developed an Aboriginal framework and an LGBTQIA+ equity and inclusion framework. And the point I'd like to just make here is that the Embrace framework has actually informed the commissioning approach to these other frameworks. So a point I'd sort of like to highlight is that this Embrace framework has utility beyond just mental health and multicultural contexts. It's a really useful set of modules and resources, and we've certainly drawn from it in our work across these other frameworks. Thanks, Ruth. So in terms of developing our multicultural framework, we pulled together an internal working group, and we undertook the self-assessment tools that Ash referred to. And that gave us a bit of a baseline for how we're tracking as an organisation, and it helped us to identify any gaps and to map out an action plan. We also drew from the modules and used some of that content to inform the development of our framework and our commissioning guidelines. And particularly pertinent was Service Module 3, which looks at, which is entitled Working Together to Promote Mental Health and in Multicultural Communities. And the focus of those modules, and particularly Principle 5 and 6, was around consumer and carer engagement and co-design and collaboration and stakeholder engagement. And that's those modules and those principles really informed our approach to stakeholder engagement. So we spoke to 80 people across 6 workshops in both metropolitan Perth and also in Kalgoorlie and Bunbury. And we contracted Rika Asoka, who's a community consultant with multicultural expertise. And we gathered the views of lots of individuals, and I'll talk about that in a moment. We also spoke to general practitioners via our GP advisory panel and with our own staff via a survey and an online workshop. And so what we were really interested in is the experiences of people accessing primary health care. And we listened to both positive and negative experiences. And that helped us to identify opportunities to improve access for multicultural people accessing health services. And we gathered a whole lot of really useful information that we fed back into the development of our framework. And what you can see here is that these are the ethnicities and languages spoken of the 80 people that were part of our consultation. So you can see there was a diverse spread of people and cultural backgrounds, and that really helped us to get some really good information and perspectives around how we can be more culturally responsive. So I just want to highlight some of the key learnings from the processes that we undertook. One is that each multicultural community is unique. It goes without saying, but really there's not a one size fits all. And any approach to improve cultural responsiveness needs to be nuanced and needs to be principled, and you know, it needs to take into account that, as I say, there's not one particular multicultural community. Also, what we heard lots of from stakeholders was that trust and empathy within care provision is essential, and that this is an important and integral part of culturally appropriate care, and that trust takes time to build and it can be broken quickly. So it's really important that healthcare providers understand and emphasise trust in the way that they provide care. We also heard that that you can't make assumptions that health professionals from the same culture or ethnic background are going to be the best fit for the consumer. We heard Ruth say earlier on that one of the focuses of the Embrace framework is around promoting person-centred approaches, and that's certainly something that we heard loudly and clearly from people we spoke to, and that assumptions can't be made in terms of the right fit for people. We also heard about the need for trauma-informed approaches and understanding that people have a background that has, you know, that influences where they're at with their healthcare needs, and sometimes that background can be highly traumatic. And so healthcare providers need to be trained and ready to support people through provision of trauma-informed care. We also got some feedback around understanding that time needs to be managed clearly and carefully in healthcare provision, particularly when there's interpreters involved. So general practitioners often provide short windows, and what we heard from consumers is that they need to get really clear information from general practitioners around how long they've got, and around how the time's managed and how it's charged. So some thinking around that needs to occur, and we've incorporated that into our framework. And the last point I'd like to make was around the need for simple and easy to navigate community feedback mechanisms, and that these need to be tailored for multicultural communities. We heard instances where people had feedback that they'd like to provide, but that they weren't able to access or navigate the complexity of the feedback mechanisms. So that's something that we've been promoting through the approaches that we're implementing going forward. Thanks, Ruth. Final thing I'd like to raise is that as part of our work with the Embrace framework and developing our own framework is that we established a multicultural stakeholder reference group. And this group has been made up of multicultural community members and primary healthcare professionals, and it's provided advice throughout our process. That's been both editorial, it's feedback on the content, and also the choice of locations where we've held stakeholder consultations. And as a result of this project, our reference group is continuing as an ongoing source of information and expert advice. Now, that's my final slide. What I would like to do is just thank the Embrace team for the support that they've provided us in the process. We've found Ash and Ruth to be really encouraging. They've given us good mentorship on how to implement the Embrace framework. And our experience of the Embrace framework has been a really positive one. So I really encourage any service providers or PHNs to access the framework. Thanks, Ruth.
Thanks, Alex. That's a wonderful example of how the framework can be applied to a local context and to assist services to develop their own tailored response to multicultural communities in your region. So thank you. We really appreciate you walking us and stepping us through that process. We've got some time now available for questions. So really encourage you, if you haven't put a question in the Q&A box at the bottom of your screen, please do that now. You can also add your vote to the questions that are already there by liking a question, and that will just give us an indication of how popular that question and how many people would like that question answered. Please do that as I'm talking now. And if you joined us a little bit late, you might have noticed that we're not using the chat function or the raised hand function, just due to the number of people that are joining us here today on the webinar. I will start by answering a few quick questions that have come up. The first question I'd like to answer is, how long does it take to complete the framework? So you remember that when Ash was talking through the different steps, usually each module takes around an hour to go through the self-assessment phase and then to step through an action plan. So about an hour for each module. We recommend that you do use a working group and do that together as a service so that you can critically appraise how your service is going together. The second quick question I can answer is, will the PowerPoint slides be available after today's webinar? And yes, the answer is this webinar is being recorded and it will be available on the Embrace project website in the next week or so. We will also endeavour to send out PowerPoint slides via email in addition to that as well in the next week. Keep popping your questions in the Q&A and voting for the questions that you would like. I'm going to ask my colleague Crystal now to just identify particular questions, and we'll take those now. Thanks, Crystal.
Sure. Thanks so much for all the great questions, and particularly for the upvotes. It makes it much easier for us to see what the majority wants to know. So the first question I'll throw to the group is, you mentioned, Ruth, evidence-based practices, yet the evidence is really not from research within CALD communities. What are you doing to encourage more research within CALD?
Thank you for that question. And yes, you're right. There is a real need for specific evidence and research around what works and what the issues are for CALD communities. In the Embrace project, we have been commissioned, and we also commission particular research projects. If you are familiar with the work of the Embrace project, you'll know that last year we launched two pieces of research that we commissioned. One was with the National Mental Health Commission, which is around the impact of COVID-19 and the mental health needs of people from Turkish, Italian and Vietnamese communities. We did a webinar on that research, and that report is on our website, and that really drilled down to what happened for those particular communities during COVID and how they accessed mental health support and what the issues were for those communities. And that was a really good policy recommendations in that report that can be applied across mental health services for how you work with CALD communities in mental health support. And there were some really great recommendations around co-designing, going to where people meet, using known and trusted leaders, bicultural workers, all of those things that we know are good practice that were reinforced by that research. We also commissioned some research last year on stigma in 3 communities in Sydney. We looked at stigma in the Congolese community, Arabic speaking, and in the Mandarin and Cantonese speaking community. And we've published a couple of research articles and a report, which is also available on our website. So as we commission particular pieces of research. We do have some more pieces of research that are in the pipeline we hope to get going in the future. But in addition to the pieces of research that we commission individually, we do collaborate with other research organisations and university bodies that are conducting research, and often we'll get asked to join particular reference groups or advisory groups to provide our input and research input onto those particular pieces of research. So where we find there is research published by universities, organisations, where we come across really good pieces of research, we absolutely share them through our newsletter and put them on our knowledge hub on our website. And where we can, we also commission research that we think is particularly relevant and useful. And we try to promote the shared learnings of those research projects through our networks, through our website, through our newsletter, and through particular webinars. So yes, I agree, we absolutely need to increase the amount of research and the evidence base of what works, what's the evidence, what the particular issues are, and how we need to shape our mental health service to make sure that we're really meeting the needs and we're really actually targeting where we need to and to get the right outcomes. So I hope that helps to address that question.
Next question is, does the framework consider intersectionality?
Yes, that's a great question. And that we have over the years considered lots of different issues around intersectionality. The framework has been developed from the National Cultural Competency Standards, which were developed a number of years ago. And absolutely where there are issues of intersectionality, particularly in Module 2 around service delivery, we incorporate all service delivery to consider issues of intersectionality around issues like gender, disability, all those issues that we know are really important. And we really, as we've already alluded to, try to make sure that all mental health services address every part of a person's individual support needs. And so that is part of this diverse place that we are all working in, that all of those particular considerations are taken into account. And so particularly in Module 2, where we're looking at actual service delivery, that is a key element in the module.
Great. There are a couple of questions, and I know, Ruth, you did mention in the beginning the target audience for this particular webinar, and that we're really interested in hearing about additional needs to inform additional webinars and deep dives. So I think that might be related to this, but questions around how the framework can be used in the mental health consumer and carer advocates work. And actually a related question around if an actual module can be produced for consumer and care advocacy.
Yeah, that's a great question. And as I said at the beginning, the Embrace Project really values the contribution and the input of people with lived experience, both consumers and carers. We do have our own consumer and carer lived experience group that we draw from very richly. We meet with several times a year to glean their knowledge and experience and to really listen to them and hear from them what the issues are, both in experiencing mental health distress within their families and their communities, but also to hear about what sort of support they're receiving and if that's appropriate, and what some of the obstacles and barriers are and what the issues are. So lived experience is really important to the Embrace framework. We have a number of mechanisms that we use to make sure that lived experience is fed into the right processes. Through our project, we use that information that the lived experience gives us to feed into all our particular initiatives in the projects, like the suicide prevention pilot project that Crystal is involved in, like the community engagement projects that we're running in 12 communities around Australia. All of those particular lived experience principles and practices and reflections get fed into our processes internally in the Embrace Project. But we also share the wonderful wealth and knowledge of our lived experience group outside of the project. We have some members of our own called Embrace Lived Experience Group who are represented on the National Mental Health Consumer and Carer Forum, and they're very active in promoting the needs of people from migrant and refugee communities in that mainstream national forum. We also feed into other national processes like the MALEAN, the Primary Health Lived Experience Group, and we've attended a number of those meetings. And we often get asked by organisations like the Mental Health Commission when they're running sessions or processes or conducting inquiries around particular issues affecting lived experience consumers and carers to provide input, and we feed that to our lived experience group and we pull together their views. So we're always looking out for ways that we can utilise our lived experience group and share their knowledge and their learnings and glean their wisdom and feed that into national processes. In terms of a particular framework, we are aware there's a lot of work going on, particularly through the networks we have here at Mental Health Australia, through the National Mental Health Consumer and Carer Forum, and the work and the progress that's going on in that space. And we make every attempt where we can to feed into those mechanisms and make sure that the input from our lived experience group gets fed into those processes, so that's incorporated as well.
Great. There's a question for Alex here. And Alex, the question is, you use consultation rather.
Crystal, you're on mute. You've gone on mute.
Sorry about that. That was my problem.
Sorry about that. So can you hear me now? Fantastic. So Alex, the question for you is, you use consultation rather than co-design to talk about the development of your strategies and frameworks. Do you mean expert advice and consultation, or authentic co-design?
Yeah, thank you. That's a good question. I would say that the process that we undertook to develop our framework was using expert advice. We consulted widely, but I wouldn't say it was a co-design process, though we drew from that principle, which is what I was referring to. I would say, though, we have utilised some authentic co-design processes that have come out of this. One of which is that we've developed in consultation with co-designed with our reference group, a plain English guide for explaining what we do as a primary health network, and taking out a lot of the health jargon that often surrounds documents like this. And the intention around that, or what we're looking at, is translating that document so it's accessible for multicultural communities. And so that was an extensive process of co-design where we worked with our reference group to develop that tool. Yeah, so I hope that answers that question.
Thank you, Alex. We have a good question here about how the framework can be applied to community family services. So not with the mental health focus, but with the counseling and family system focus.
That's a great question. Thank you. We often get asked questions around the framework, and is it applicable to other settings outside of mental health? For example, is it applicable to drug and alcohol services? Is it applicable to other services? And absolutely, the principles within the framework can be applied definitely, and are transferable. And that's really the approach that we've taken with the framework. Is it's flexible and it's not rigid. You can take what you would like out of the framework. You can take questions that you'd like, and I think that's some of the beauty with the work that we've done with primary health networks, is where they're commissioning services, they've been able to use the parts that are relevant to commissioning services. Where they don't deliver services, they've been able to maybe play down that part of the frameworks. So yes, absolutely. Particularly, I think all of the modules will be really transferable. Looking at strategies and policies and organisational processes will be relevant. Looking at service delivery, module 2 would be very relevant. Looking at early intervention and promotion, module 3, and then looking at workforce, module 4 would absolutely be relevant. So I'd really encourage you to go in and have a look and see how you could apply that to your service.
Fantastic. There's a couple of questions in here. Well, actually, let's take this one first. So how do you tackle the issue of a group, culture, or religion that may have clear needs, however, do not engage? And maybe how the framework would help someone approach that.
Yes, That's a great question as well. And I think that goes to a lot of the issues about how you work with different communities effectively in building trust, developing rapport, working with established leaders and gaining their trust and their confidence. And it's often a long-term approach that we need to take in developing those relationships and building trust and rapport. Sometimes it takes a long time to build that trust, and it can be really helpful to work with other organisations that are known and trusted within that community, for example, a faith group or a migrant resource group, or accessing places where we know that people from that community go to. I know that lots of communities that we see in our community engagement project tap into things like soccer clubs or women's groups or other places where youth groups at school, where people are going that they feel comfortable, where they feel safe, and developing relationships, as I said before, where people meet, where they feel comfortable, where they feel safe. So building those relationships, developing relationships with community leaders, with faith leaders, going to outside of formal settings like government buildings can be really helpful. Actually doing some outreach and some really creative thinking around how can we work with these communities using organisations, might be a migrant resource centre, might be a torture and trauma service that are running groups, and trying to access those groups as well. I hope that helps.
Great. We do have some questions just about the framework functionality, so it might be good to just address a couple of those. One of them is around when the modules are completed, is the information from the module able to be saved and printed for reference later?
Yes, absolutely. All the information is saved onto your profile. And so when you log off from the framework, your information is saved. And when you log back in, you'll be able to pick up where you started, and all the information that you've put in before will be there ready for you to go again. So yes, absolutely, it's saved.
Okay. Fantastic. And this one actually it's a really good one. So is there a network of services of those using the framework, networking for each other and with each other?
That's also a really great question. And one of the things that we focused on in the last year, as Alex is a great example of, is doing some focused work with primary health networks. And we targeted 13 primary health networks that we worked with closely. And we had some community of practice webinars with all of those 13 primary health networks, where everyone shared how they were using the framework and some of the learnings, some of the obstacles, some of the things that they'd done to maybe adapt the framework. And Alex is an example today of how that information was presented. So we do absolutely run those community of practices. At the moment, we're doing some with primary health networks, and we run general webinar sessions. And if there's a particular need for a community of practice around the webinar for people who are using the framework, very happy to plan that in the future. Can I also say that the Embrace Project does some targeted work with particular organisations? So through the Suicide Prevention Pilot Project, we're working with organisations working particularly in suicide prevention with the framework. So for example, Are You OK and Suicide Prevention Australia are two organisations that we're targeting to work with the framework, and they will share their learnings together. And we also get, as you know, people would contact us who might want to look at a whole range of similar services that are working with youth. So we can run some sessions for youth services or a particular subgroup within mental health.
Fantastic. There is another question to Alex. I think it would be good before we run out of time. The question, Alex, is what are the criteria for your reference group?
Thank you for that question. So our reference group has a range of people with lived experience of mental health issues from multicultural backgrounds. It also has clinicians. So I think what we were after, I don't have the criteria in front of me to specify exactly, but I think the key thing is a mix of perspectives and an ability to provide high-level advice, both in the development of frameworks and commissioning guidelines, but also just more broadly to sort of provide advice on WAFA as a primary health network around cultural responsiveness, and also the services that we commission. It might be possible for me to link to something around that. I'll look into that, after this session. But hopefully that's gone some way to answering that question.
Fantastic. There are so many good questions on here. We actually are, we do need to move into our wrap up, but there's one question at the very end that I think will be a quick one and worth mentioning. It says, has the framework been revised since its inception? And sorry, the question just jumped away. But it was around, has it been revised since an inception? And will there be a review in the future?
Yes, that's a great question. So the framework has been in existence in various formats for around 15 years, maybe a little bit longer. As I said, it was originated from the National Cultural Competence Standards, which originated, as it happens, Alex, in Western Australia, and then were taken across more nationally and developed as a set of standards into the framework. When Mental Health Australia started working on the Embrace project, the framework had been evaluated by an academic institution in Wollongong, and they made a whole series of recommendations around the framework being redeveloped into a series of modules, which is what has happened in the last 4 years. So the framework has been redeveloped based on that evaluation into the current format to make it more accessible into the module format, because before, I don't know if you had seen it before, it was a little bit difficult to negotiate as one entire product. So the modules breaks it down, makes it more accessible, makes it more flexible, so that's the way it's been set up in the last few years. When resource depending and looking in the future, we are looking at how we can adapt the framework and refine it. We're always looking to update the resources in the drop-down menus that Ash alluded to and add new resources. The National Mental Health Service Standards that the framework is developed to and aligned with, and the National Quality Safety Standard services that the framework is also aligned to, are updated, and as resources allow us, we'll make sure that they transfer over so that they're also reflective and current. So we have, worked with primary health networks. We've developed specific resources for primary health networks that are useful for primary health networks in using the framework. And we draw very heavily on other frameworks and recommend other frameworks. For example, there are frameworks for young people in working with cold young people that we promote through our framework. There are frameworks for working with cold older people that we also have in our framework. So where there's frameworks that are already existing that complement our framework, we make sure they're available in our framework. But going forward, we're always looking to update and make changes to the framework where we can. So look out for that in the future as well.
Great. Fantastic. And so that will close the Q&A, but we do have the questions that weren't answered. And so I will hand it over for wrap up.
Thanks, Crystal. So I really hope that this afternoon has given you a flavour for the framework and how it can be used in your workplace, and how you can use the framework as a tool, a scaffolding structure to give you some strategic and comprehensive stepped-out guidance on how you can improve your service delivery with refugee and migrant communities. So I'm just going to take us back to those 3 questions that I posed at the beginning of the webinar. What change do we want to see in our services? And this is something you can think about as you go back to your workplace, into your staff meeting, and talk about the webinar and the framework. What principles do we as a service want to incorporate? And then lastly, how will my service use the framework to achieve the change that we want to see? So there's some of the take-home messages that I want us to keep thinking about and consider how you can use the framework, how you can use the resources that the Embrace project has. I really encourage you to go into the website, have a look through the framework, have a look at the resources, register for the framework and really take a really good look. It stops you from doing a lot of thinking and work from the bottom up. It really has done a lot of the work for you. So have a great look and take that back to your services for further conversation. Just in terms of what else is available to you, as we mentioned, there are links to resources throughout the framework. There's an introductory module that is available in the framework on cultural responsiveness, and that's a really good place to start. We do have 5 webinars that are recorded on the website. There's one on each of the 4 modules, and then one that will be an overview of the framework, and then we'll add today's webinar onto there as well. As I mentioned earlier, there is the Knowledge Hub on the website, which again gives you a lot of resources and a lot of rich information on resources in this area. We have the user guides that's similar to the one example of one that's on the screen. What is the framework and how was it developed? All of those PDF documents are located in the framework. We continue to run workshops as needed, and we keep your eye out through our newsletter for further opportunities for webinars and workshops. So you can sign up for our e-newsletter through our website. There is a sign in at the bottom of the front page, and you'll receive our quarterly e-newsletter, which has news and updates from our project. And of course, you're very, very welcome to contact the Embrace project team through Mental Health Australia. Our number is at the end of the webinar, and our email address, we have an inbox that you can send any inquiries to and we'll get back to you. So please feel free to contact us after today, and we can talk to you further about how you can use the framework in your particular service or setting. So thank you very, very much for your time today and your attendance in this webinar. We really appreciate you prioritising this in your diaries and making the commitment to attend this webinar and to hear more about the framework. We would really appreciate your feedback about how helpful this particular webinar has been, and any additional support that you would need going forward, which will help us to plan for what else we can offer in the future. When we close the webinar, there will be a feedback survey that will pop up, and it will also be emailed to you as well. So please do take the time just to fill that out. It would take 5 minutes or less just to give us some feedback on today's webinar. So thank you very much. There's our contact details. If you'd like to get in touch with us further, please have a look at the webinar, the website, and all the wonderful things that are there. Thank you again for joining us, and I wish you a very good rest of the day and afternoon. Thank you.